Module Objective. DOT. This module delivers a comprehensive, advanced, and practical understanding of cardiopulmonary resuscitation, CPR, across 3 major age groups: adults, children, and infants. Emphasis is placed on performing high-quality CPR, integrating anatomical understanding with guidelines from top resuscitation councils, and developing competence in varying real-life emergency scenarios. The module includes rhythm, compression technique, ventilation, and safety measures to align with international training and certification standards. In-depth content. Overview of CPR, Cardiopulmonary Resuscitation. CPR is a life-saving technique designed to maintain blood circulation and oxygenation to vital organs when the heart stops. Its primary components are chest compressions, ventilations, rescue breaths, defibrillation, if required via AED. High-quality CPR increases the chance of survival, especially when delivered immediately after cardiac arrest. Understanding anatomical and age-based variations. Group, age range, and anatomical notes. We are using them in a table. 1. Infant 0 to 12 months. Fragile ribs, narrow airways. 2. Child 1 to 8 years. Higher respiratory rate, smaller thorax. 3. Adult 9+ years. Fully developed cardiovascular system. Each group requires tailored techniques due to different heart sizes, chest wall resistance, and airway sensitivities. Adult CPR 1 and 2 rescuer. Guidelines: AHA/ERC 2020 to 2025. Compression depth: at least 2 inches, 5 centimeters, but not more than 2.4 inches, 6 centimeters. Compression rate: 100 to 120 compressions per minute. Hand placement: heel of one hand over the center of the chest, lower half of the sternum. Other hand on top. Ventilation: 30:2 compression to breath ratio, if trained. Hands only if untrained. Steps: assess responsiveness and breathing. Call emergency services and get AED. Begin compressions. 30. Followed by 2 rescue breaths. Apply AED as soon as available. Child CPR 1 and 2 rescuer. Modifications: compression depth, approximately 2 inches, 5 centimeters. Hand placement: 1 hand or 2 if needed for larger child. Compression to breath ratio: 30:2 for single rescuer, 15:2 for 2 rescuers. Special considerations: children may suffer respiratory arrest first before cardiac arrest. Prioritize airway and breathing in initial assessments. Infant CPR 1 and 2 rescuer. Distinct techniques: compression depth 1.5 inches, 4 centimeters. Rate: 100 to 120 per minute. Hand placement: 2 fingers just below the nipple line, 1 rescuer. 2 thumbs encircling chest, 2 rescuers. Ratio: 30:2 for 1 rescuer, 15:2 for 2 rescuers. Keynotes: be cautious not to overextend the neck during head tilt. Ensure gentle but adequate breaths, just enough to see the chest rise. Common CPR mistakes and how to avoid them. Mistake correction: shallow compressions. Ensure full depth with body weight. Slow rate practice rhythm with metronome, 100 to 120 beats per minute. Not allowing chest recoil. Fully release after each compression. Hyperventilation: give only enough air to see chest rise. Delayed compressions: minimize interruptions, no more than 10 seconds. Quality indicators for effective CPR: proper compression depth and rate, chest recoil between compressions, minimizing pauses. Proper hand position technique: using barrier devices for safety, if available. Visual confirmation of chest rise with breaths. Tip: use feedback-enabled mannequins in training environments to monitor compression quality and depth. Integration with AED. CPR should be continued until an AED becomes available. Once the device arrives, apply pads to the bare chest. Follow automated prompts. Continue compressions immediately after shock or no shock advisory. Legal and ethical aspects. Good Samaritan laws protect lay responders. CPR certification validates competence. Ethical obligation to act within training level. Maintain confidentiality. Respect cultural beliefs and assess scene safety. Learning outcomes. By the end of this module, you will differentiate CPR techniques for adults, children, and infants, demonstrate step-by-step high-quality CPR procedures, recognize age-specific anatomical concerns, apply appropriate compression and ventilation ratios, evaluate their CPR performance using quality indicators. Accreditation compliance. This module is designed in alignment with global CPR training standards, specifically American Heart Association, AHA, Basic Life Support Curriculum European Resuscitation Council, ERC, 2021 Guidelines, UK Resuscitation Council BLS, Theory Standards, Health and Safety Executive, UK, First Aid Training Regulations, ISO 21001:2018 Education Organization Standards.